Let's now talk about Chinese and Western medical thought, values, and disease causation. As a practical matter, medical scientists and researchers need to convey their findings on disease causation to healthcare and health policy managers who make decisions on allocation of resources to prevent and treat the disease in the communities that they manage. Multi-causality models of disease are inadequate for this purpose. This may account for the appeal of the etiological standpoint to medical scientists, despite its inadequacies. Despite its inadequacies, a scientist need only to identify one cause for each disease and are spared the trouble of dealing with multiple and often mutually interacting causes. With multi-causality models, the scientific researchers need to exercise judgment as to which factors to include in the causal model for statistical investigation. To the extent that the values come into play in these judgments, the identification of causes is value-laden. In practice, there are numerous candidates for causal factors, but as Nagel points out, the interest of the scientist determines what he selects for investigation. Different choices of factors lead to different causal pies. The term value here and the manner that some philosophical discussions on the notion of science being value-laden have used it. Some may prefer to use interest instead of value, as Nagel does in the above quote. We shall continue to refer to value with the caveat that it has a different meaning from its other uses, such as moral values. Take our earlier tuberculosis example. Great strides in eradicating the disease have been made since Koch's discovery of the tubercle bacillus, but the disease has not been stamped out. In many parts of the world, its incidence is in fact increasing with mutations to strains of the bacillus that are resistant to antibiotics like streptomycin and rifampicin, commonly used for the treatment of the disease. The pharmacologist developing vaccines against the tubercle bacillus and antibiotics to kill it understandably regards the disease as being caused by a bacterium, as this would be consistent with his mission of creating agents to fight the bacillus and the value he therefore places on discovering new antibiotics. But to the epidemiologist working in poor countries where tuberculosis is still a serious killer, the cause of tuberculosis may not be the bacillus, but rather the stresses of overwork, poor diet, and unhealthy sanitary conditions. This provides the basis for the bacillus to spread and take hold in the human body. Thousands in Asia and Africa die of the disease for very much the same reason that John Keats and Jane Austen are thought to have contracted the disease: poor nutrition and unhealthy living habits and conditions. Knowledge about the kind of the tubercle bacillus associated with fresh outbreaks of tuberculosis in some regions of the world is of limited value for controlling the spread of the disease, although it might lead to cures for those who have succumbed to it and are fortunate enough to receive treatment with antibiotics. Knowledge of the dietary factors and sanitary conditions that are associated with it, which may be obtained from epidemiological studies that include these factors in the causal pie, guides healthcare providers to determine optimal health expenditure plans. Thus, one can make the argument that effectiveness for achieving medical objectives would guide the researcher in the inclusion of components in the causal pie. This value medical efficacy value favors research programs that focus on causes of illness that can in practice be addressed by public health policy. A similar line of reasoning applies to TCM notions of causality in illnesses, which is focused on those factors that a person can manage in order to avoid falling ill. Thank you for your attention.
We continue with interviewing techniques, still on thirst, appetite, and taste. Preference for cold foods signifies heat patterns. Preference for hot foods would mean cold patterns. Poor appetite or easily satiated, spleen qi deficiency. No appetite in the morning would signify stomach and spleen qi deficiency, damp phlegm. Insatiable hunger or becoming hungry shortly after having eaten is stomach fire. Aversion to food is food stagnation. Acid reflux signifies stomach fire. Nausea after eating, spleen qi deficiency, food stagnation. Nausea caused by emotional pressure and stress is liver qi stagnation. Nausea caused by hunger, spleen qi deficiency. Nausea during the premenstrual period is liver qi stagnation. Morning sickness would signify rebellious qi in the chongmai, stomach and spleen qi deficiency, liver and stomach fire, liver qi stagnation, stomach yin deficiency. Acute vomiting is invasion of exogenous pathogenic factor, food stagnation. Chronic vomiting means food stagnation, damp phlegm, liver qi stagnation, stomach fire, stomach and spleen qi deficiency, spleen yang deficiency. Explosive vomiting, excess patterns, thin, slimy vomit is damp phlegm. Sour or bitter vomit means heat in the stomach, liver, or gallbladder. Clear and watery vomit, that is odorless, cold in the stomach or spleen yang deficiency. If there is blood in the vomit, that means there is blood stagnation or stomach fire. Burping with a taste of food that has been eaten earlier is food stagnation. Imbalances of the various organs can result in a person being attracted to specific flavors. This is most typically seen when someone who is spleen qi deficient has a craving for sweets. The problem is that they often respond to the signal by eating sweets, cakes, or other things that have a high sugar content and have a very concentrated sweet flavor. This will overload the spleen and create dampness, which further weakens the spleen. This causes the weakened spleen to crave more sweet food. The consequence will be that because the spleen is even weaker, the craving for something sweet will be greater and a vicious cycle begins. The craving for the other flavors are not as evident in imbalances of the other organs. It is interesting how many people are attracted to the bitter flavor of coffee. Certain flavors can be appealing to some people, not because of the organ that the flavor resonates with, but due to the energetic dynamic of the flavor. For example, the spicy flavor is very dynamic and can help to disperse stagnant qi. Imbalances in Zangfu organs can also manifest with a person experiencing a certain taste in their mouth. Bitterness is the taste that relates to the fire phase. If the person experiences a bitter taste in their mouth, often they will describe it as a bad taste or a metallic taste. It will not necessarily be a heart imbalance. The fire phase resonates with fire and heat in general. This means that a bitter or metallic taste can be seen when there is fire in the stomach and liver, as well as the heart. Liver imbalances can manifest with a sour taste in the mouth. A sweet, sticky taste or sensation in the mouth will be a sign of dampness or phlegm. The person will sometimes brush their tongue to get rid of the sticky sensation that often accompanies a very greasy tongue coating, which in itself can be a sign of dampness and phlegm. It is important to remember that some medicines can result in an unpleasant taste in the mouth, it is important to assess whether the taste is due to a change in the body's physiology. For example, a bitter taste is a reason because medicine has created heat in the body, or whether the taste itself is from the medicine and therefore has no diagnostic significance. Lacking a sense of taste is mostly a manifestation of spleen-chi deficiency, but can also result from phlegm in the lung that clogs the nose and sinuses, or blood stagnation in the nose after a physical trauma. This is because aromatic flavors are discerned in the nose. Craving for sweet signifies spleen-chi deficiency. No sense of taste, spleen-chi deficiency, lung phlegm, or blood stagnation. Sweet, sticky taste in the mouth would mean damp phlegm. Bitter or metallic taste in the mouth, heart, liver, and stomach fire. Sour taste or taste of previously ingested food is food stagnation. Thank you for your attention.
Let's continue with diagnosis according to pathogenic chi. For today, we discuss about invasions of exogenous wind. Wind is a very young form of pathogenic chi. Wind is the prevailing chi in spring, although invasions of wind are not exclusive to this season. Both wind and spring do have a powerful resonance with the wood phase and its dynamic yang energy. Wind's yang nature is seen in its mobility and speed. Wind has an expansive and thereby spreading dynamic. Imagine a pile of leaves lying in a heap on the ground. Heat, dampness, and cold will only result in the leaves drying out, becoming heavy and soggy, or freezing into a solid mass. But a gust of wind will spread them in all directions and set them in motion. This ability of wind to spread things apart enables it to penetrate through the weight chi, while drawing other forms of pathogenic chi into the body. This is the reason it is said that wind is the spearhead that conveys other forms of pathogenic chi into the body. This is very important for yin forms of pathogenic chi, such as cold. Cold has a contracting nature and therefore results in the pores in the skin contracting and closing, blocking its entry. Wind can spread open the pores and thereby lead cold through the skin and into the body. This is similar to a drafty cabin in winter. If the temperature is sub-zero outside, but it's completely windless, it is possible to warm the cabin with a small stove. If, on the other hand, the temperature is 10 degrees centigrade, it is still difficult to keep the cabin warm if the wind is blowing outside. This is because the wind will drive the cold into the cabin through the cracks in the walls. Wind's yang nature means that it has a tendency to affect the head and the upper parts of the body, as well as the outer aspects of the body, that is, the Wei Qi aspect. Wind's dynamic yang nature also means that the symptoms and signs that are manifesting can have a tendency to migrate from place to place and to be variable in character. This is characteristic of the form of being known as wind being, where the pain in the joints constantly changes character and location. Wind's yang nature also manifests in a sudden onset of its symptoms and signs. Wind creates movement because it is yang. Wind can often manifest as tremors, spasms, and itching. Extreme stiffness and paralysis can also be a symptom of wind because when something vibrates very strongly and quickly, it becomes stiff and rigid. Wind has a resonance with the Julian aspect. This is shown by people's eyes watering when it is windy. Both the eyes and tears relate to the liver through the five phases, as does wind. Internally generated wind can arise as a consequence of liver imbalances. Many of the symptoms of internally generated wind and exogenous wind are similar, but the etiology and the treatment principles will be very different. The liver is not the only lung organ to have a relationship with wind. The lung is easily affected by wind, as it is the only lung organ that is in direct contact with the environment outside of the body. The lung also controls wei qi. This means that the invasions of exogenous wind will often affect the lung and its sensory organ, the nose. Furthermore, if there is lung qi deficiency, wei qi will also be deficient and the person will be easily invaded by exogenous wind. Let's take a look at invasions of exogenous wind. The patterns seen where there is an invasion of exogenous wind are wind cold, wind heat, wind dampness, wind water, wind cold damp B. An invasion of exogenous wind will nearly always be an acute pattern. The exception of this is wind B, which will often have developed into a chronic pattern. Invasions of exogenous wind will generally be relatively short-lived. The pathogenic qi will either be expelled again or it will penetrate deeper into the body. Now let's talk about its etiology. The invasion is due to there being a virulent pathogenic qi, which has been strong enough to break through the defenses of the body's wei qi. This could be when a person has been exposed to climatic wind, but it can also be that they have been exposed to an artificial indoor climate such as air conditioning. Furthermore, some allergens and viruses can manifest as exogenous wind pattern. There can also be an underlying wei qi deficiency, which means that pathogenic wind does not have to be that strong to be able to break through the defensive qi. For the symptoms and signs, the specific symptoms and signs will depend on the individual patterns. Typical symptoms and signs that are seen where there is an invasion of exogenous wind are acute symptoms that arise suddenly, stiffness, numbness, tremor, and itching or tingling sensations in the skin, pain in the joints, pain that migrates from place to place and is variable in character, headache, aversion to cold and wind, a disturbance of the functioning of the lung, resulting in coughing and sneezing, and a superficial pulse. Thank you for listening.
Let's discuss diagnosis according to 12 regular channels. The treatment of channel problems, part 2. The stomach channel imbalances, symptoms and signs. Pain, weakness, or tenderness along the course of the stomach channel, skin and tissue changes along the course of the stomach channel, red eyes, stinging or burning pain in the eyes, thighs, parodontosis, toothache, bleeding gums, mouth ulcers, red and swollen gums, jaw pain and tension, nosebleeds, tenderness or pain in the breast, sore throat and pain in the esophagus, stomach ache and abdominal pain. Facial paralysis, muscle wasting or muscle weakness in the legs, ulcer, spots, acne around the mouth, on the cheekbones, upper back, and chest. Acupuncture treatment, local distal and ashy points on the stomach channel, possibly combined with spleen 4. Next, the spleen channel imbalances. For the symptoms and sign, there is pain, weakness, or tenderness along the course of the spleen channel. Skin and tissue changes along the course of the spleen channel, heavy, cold, or weak legs. There is abdominal pain, vaginal discharge. For the acupuncture treatment, local distal and ashy points of the spleen channel possibly combined with stomach 40. Next is the heart channel imbalances. For the symptoms and signs, there is pain, weakness, or tenderness along the course of the heart channel, skin and tissue changes along the course of the heart channel. There's chest and cardiac pain, pain or other sensations that radiate out from the chest along the arm, hot or sweaty palms. For the acupuncture treatment, local, distal, and ashy points on the heart channel possibly combined with Li7. Next, the small intestine channel imbalances. For the symptoms and signs, there is pain, weakness, or tenderness along the course of the small intestine channel. Skin and tissue changes along the course of the channel. There is ear pain, deafness, jaw pain, or stiffness. Sore or stiff neck and shoulder tension or pain, elbow pain, fever, and aversion to cold. For the acupuncture treatment, local, distal, and ashy points of the small intestine channel possibly combined with heart 5. Next, the urinary bladder channel imbalances. For these symptoms and signs, there is pain, weakness, or tenderness along the course of the urinary bladder channel. There's skin and tissue changes along the course of the channel, sore eyes, sinus pain, headache, sore or stiffness in the neck, back pain, sore or stiffness in the lower back or sacrum, pain along the back of the legs, sciatica, black nose, nosebleeds, fever, and aversion to cold. For the acupuncture treatment, local, distal, and ashy points on the urinary bladder channel, possibly combined with kidney 4. Thank you for your attention.
Let's discuss treatment principles, expelling the pathogenic factors. Expelling pathogenic factors includes any method that eliminates pathogenic factors, whether exterior or interior. This might be acupuncture, herbal treatment, massage, or cupping. From acupuncture's point of view, it involves eliminating the pathogenic factors by using the reducing method, bleeding, or cupping. This approach is applicable only in purely excess patterns characterized by the presence of an exterior or interior pathogenic factor. Expelling the pathogenic factor will remove any obstruction caused by it and will indirectly contribute to strengthening upright qi because it can circulate unhampered by the obstruction of the pathogenic factors. Hence the saying, eliminate the pathogenic factors to strengthen upright qi. This is very true in practice, and we have seen how expelling pathogenic factors improves a person's qi, and contrary to what one might think, it gives patients more energy. As a clinical note, expelling pathogenic factors often produces an increase in a patient's energy as his or her qi flows unencumbered by obstructions. It is important to note that the decision to expel a pathogenic factor by using a reducing method must be based purely on the excess character of the pattern and not on subjective feelings about the patient. We should not translate subjective emotional feelings into a desire to tonify or sedate. In other words, if the pattern identification is correct and the pattern is definitely of an excess character, a reducing method is called for, even if the patient might be elderly or apparently weak. If the pattern is of an excess character and the pathogenic factor is expelled, the patient will feel better and have more energy because the obstruction of the pathogenic factor is removed. This is especially true in exterior conditions when it is necessary to use the reducing method to expel the exterior pathogenic factor. Where the reinforcing method used to tonify qi, the patient would become worse because tonifying qi in acute exterior conditions tends also to tonify the pathogenic factor and thus aggravate the situation. For example, if a patient has symptoms of an attack of wind cold, such as an aversion to cold, runny nose, sneezing, stiff neck, and a floating tight pulse, this is an excess condition, even though the person might have suffered from deficiency of qi or blood previous to the exterior attack. This condition is therefore treated by expelling the pathogenic factor, in this case, wind cold. We can later attend to the underlying deficiency and tonify qi and blood, but only after the pathogenic factor has been expelled completely. Of course, in a few cases where the patient is extremely weak and debilitated, it might be necessary to combine the reducing method to expel the pathogenic factor with the reinforcing method to tonify Qi. This is, however, rarely necessary. Another example of an excess pattern, in this case interior, which requires treatment by the method of expelling pathogenic factors, is that of liver fire. With symptoms and signs such as thirst, red eyes, red face, bitter taste, constipation, dark urine, headaches, irritability, red tongue with yellow coating, and a rapid and wiry pulse. Please note that the method of expelling pathogenic factors may also be applied in mixed full-empty conditions. We do this when the pathogenic factors are strong and are causing most of the clinical manifestations. We would do this only in the beginning of the treatment to rid the body of pathogenic factors so that it will be easier to tonify the upright Qi later. For example, if we see a patient suffering from chronic fatigue syndrome with a very pronounced dampness in the digestive system and the muscles and a spleen deficiency, but with most of the clinical manifestations caused by the dampness, we would start the treatment by giving him a herbal prescription to eliminate dampness. After some weeks of this treatment, we would then also tonify the spleen. So the strategy of expelling pathogenic factors is applicable only in purely excess patterns characterized by the presence of an exterior or interior pathogenic factor. Thank you for your attention.
Let's continue with diagnosis according to Zhang Fu organ patterns. Now let's talk about lung dryness. The lung is the only Zhang organ that is in direct contact with the environment outside of the body. This means that the lung is very vulnerable to dryness because it will injure the fluids and the yin aspect of the lung. In many parts of China, the climate in the autumn is very dry. This resonates with autumn being the season where lung imbalances can be more common. Lung dryness is a precursor of lung yin deficiency. The difference being that in lung dryness, there are signs of dryness without there being decidedly yin deficiency symptoms. Now for its etiology. In Northwestern Europe, lung dryness is not specifically related to a particular season. It can be experienced in the northern Scandinavia and mountainous areas in the winter when their air is extremely dry and when it is very cold. Dryness can be experienced throughout the year in buildings with very dry indoor climates, especially in concrete buildings with central heating. For its symptoms and signs, there will be dry cough, possibly with dry skin and sputum. There may be pain in the chest if the cough is bad. There will be dry mouth, dry throat, dry skin, thirst, hoarseness, dry tongue. The pulse can be rapid or it may be fine in the right tune position. For the key symptoms, dry, ticklish cough, hoarseness, dry mouth, dry nose, and dry throat. The treatment principle, we moisten the lung and nourish lung yin. For the acupuncture points, we may choose from lung 7, lung 9, RAN 5, RAN 12, kidney 6, and stomach 36, and we use the tonifying needling technique. So for the explanation on the choices of points, lung 9 nourishes lung yin and jin ye. RAN 4 and kidney 6 nourish yin and jin ye. RAN 12 and stomach 36 nourish stomach yin, which is the root of jin ye. Lung 7 and kidney 6 open RAN mai and yin shao mai, nourish yin, and thereby lead yin fluids up to the lung, mouth, throat, and respiratory passages. For irrelevant advice, the advice given for patterns of lung yin deficiency will also be relevant where there is lung dryness, especially the advice not to stay in places where the air is very dry. Lung dryness can be caused by stomach yin deficiency or lung yin deficiency, and in turn, it can result to lung yin deficiency. To summarize, Wind dryness invading the lung has its etiology in exposure to climatic wind and heat. Its signs and symptoms are dry cough without phlegm, with scanty phlegm not easily expectorated, an aversion to cold, fever, dry throat, tickly throat, dry nose, dry lips, discomfort in the chest. The pulse will be floating and the tongue will be red with yellow or white fur or coating. For the treatment principle, we clear dryness, moisten lung, suppress cough, and transform phlegm. For the acupuncture treatment, we use lung 7 to release the exterior and expel wind, Sanjiao 5 to expel wind and release the exterior, spleen 6 to supplement the body's yin, bladder 13 to supplement lung qi, Li4 to release the exterior, Ren 12 to descend rebellious qi, bladder 12 to expel wind, kidney 6 to disinhibit the throat. We needle with drainage. For generalized sweating and aversion to cold, we could drain bladder 12, GB20, and bladder 11. Thank you for your attention.
Let's discuss diagnosis according to 8 principles. Excess cold, part 2. While there is a possibility of a slight fever or sensation of fever in the body when there is an invasion of wind cold, this is not the case when there is interior excess cold. Perspiration will be normal because Wei Qi is not blocked from controlling the pores in the skin. The pulse will be deep because pathogenic Qi is in the interior, and the cold stagnation will make the pulse tight or confined. The tongue will be a key diagnostic factor. When there is interior excess cold, there will be a thick white tongue coating, and the coating is often wet. Interior excess cold will disrupt and block fluid physiology. There will therefore be an increased volume of urine. The urine will be clear and there will be frequent urination. Cold can block the flow of qi in the urinary bladder, and this can cause the person to have difficulty urinating. The disturbance of the fluid physiology can also result in the person having a lack of thirst. Cold does not boil and condense excretion as heat does. On the contrary, exudations and discharges from the body will be more profuse. This excretion will be watery, clear, and transparent, and they will not be odorous. Cold can also prevent food from being transformed. If there's cold in the stomach, it can manifest with watery vomit. Otherwise, there will be a watery diarrhea with undigested food particles. The blockage by cold will also manifest with pain in the organ. By consuming cooling or cold drinks or food. In some cases, cold can block the movement of the feces through the intestine. This can lead to constipation and cramping pain in the abdomen. Palpitation of the area of the body or above the organ. Palpation of the area of the body or above the organ the cold has invaded will often reveal a cold sensation in the skin. The person will often also have a subjective sensation of cold in the area. Where young deficiency cold will often result in a person having slow and lethargic movements. A person whose qi and blood is blocked by exogenous cold will have movements that are stiff and limited due to qi and blood not being able to flow freely. This will usually be in a particular area of the body, such as the neck, the back, or one or more of the joints in the limbs. Excess condition manifests with stronger color than deficient conditions. When there is excess cold, the face will be white and shiny. It will not have the same dullness and lack of brilliance that is characteristic of deficient conditions. The face is white because cold has the opposite dynamic of heat. When heat's young nature drives blood upwards and outward, resulting in redness of the face, cold has a yin dynamic and draws blood to the center of the body. This is consistent with the Western physiological model, where when the body is cold, the blood is retained in the middle of the body to reduce cooling of the blood and keep the vital organs warm. Cold blockage of heat will also manifest with the person sleeping curled up to retain heat in the body. For the etiology, invasion of exogenous pathogenic chi, the symptoms and signs, there is aversion to cold, cold limbs, white face, clear urine, diarrhea or loose stool. Constipation may be seen in some cases. There's pain and stiffness. No thirst, disinclination or discomfort when consuming cold beverages and foods, clear, transparent excretion, edema, slow, tight, or confined pulse, a white coating on the tongue. The key symptoms, there is aversion to cold, clear urine, pain and stiffness, tight pulse. Thank you for your attention.
We talk about depression, specifically the pattern phlegm-heat harassing the mind. Clinical manifestations, depression, mental restlessness, anxiety, agitation, restless sleep, excessive dreaming, insomnia, palpitations, feeling of heaviness of the head, dizziness, feeling of oppression of the chest, expectoration of phlegm, nausea, bitter taste, sticky taste, tongue, red, swollen, sticky tongue coating, possibly heart crack, pulse, slippery, rapid. Phlegm obstructs the mind while heat agitates it. Phlegm obstructing the mind causes mental confusion and in severe cases, a certain loss of insight. Heat makes the person agitated, restless, and anxious. In some cases, the person may alternate between periods of depression and confusion due to phlegm obstructing the mind and also impairing the coming and going of the ethereal soul, and periods of abnormal elation, agitation, and manic behavior due to fire. In severe cases, this leads to manic depression. Phlegm obstructs the mind, causing a certain loss of insight, and heat agitates it, causing anxiety and mental restlessness, as clinical note. The pattern of phlegm heat harassing the mind is more common in people over 35 and with a tendency to obesity. Etiology is usually long-standing emotional stress, particularly worry, guilt, and anger, together with irregular diet and excessive consumption of greasy foods and alcohol. Treatment principle: resolve phlegm, clear heat, open the mind's orifices. Points: REN 12, bladder 20, stomach 40, spleen 9, spleen 6, P5, P7, stomach 8, DO 24, GB 13, GB 17, GB 18, DO 20. All points with reducing or even method except for REN 12 and bladder 20, which should be reinforced. REN 12, bladder 20, stomach 40, spleen 9, and spleen 6 resolve phlegm. In particular, stomach 40 resolves phlegm and calms the mind, and spleen 6 calms the mind. P5 and P7 calm the mind and opens the mind's orifices. Stomach 8 resolves phlegm from the head. DO 24 and GB 13 calm the mind and lift mood. GB 17 and GB 18 open the mind's orifices. And DO 20 lifts mood. Thank you for listening.